earlier videos, we have seen that iron forms a very important constituent of the red blood cells. These red blood cells, they carry oxygen from the lungs to the tissues with the help of hemoglobin, which depends on iron for its functionality. Once these red blood cells die, the body's reticuloendothelial system, it digests them and releases iron from these dying red blood cells. So the macrophages of the reticuloendothelial system, they digest these RBCs, and once they digest it, the iron is released. The released iron is taken back by the red bone marrow. Red bone marrow is the tissue that forms the RBCs, and this bone marrow uses the released iron to form the new red blood cells. So what's happening here? We see that once iron is incorporated into a red blood cell, it remains in a cycle. All the old RBCs, they give up their iron, and iron is taken up again to form the new RBCs. So you can see that whatever iron is required by the new RBCs can be obtained from the old RBCs. So why do we need more iron? And if we do not need more iron, why do we have iron deficiency anemia? So let's have a look at the causes of iron deficiency anemia. Now that's pretty simple. We know that RBCs contain iron. So very obviously, if the RBCs are directly lost out of the body, there would be deficiency of iron. So one of the most common reason of iron deficiency anemia is blood loss. So when there is loss of blood, RBCs along with iron go out of the body, and that causes iron deficiency. So what could be the reasons of the blood loss? Let's look at one of the most common reasons of the blood loss. Menstrual blood loss is amongst a very common and very important reason of iron deficiency anemia in women of reproductory age. Other than that, the chronic internal bleeding, that could be because of any reason, will result in iron deficiency anemia. Now, the most common source of internal bleeding is bleeding from the gastrointestinal tract, and the reasons could be carcinoma. It could be ulcers of the GI tract, including the peptic ulcer, the duodenal ulcers. It could be erosion of the mucosa because of aspirin or other NSAIDs, that is non-steroidal anti-inflammatory drugs. These drugs, they erode the mucosal membrane, may result in ulcers and chronic gastrointestinal bleeding. Hemorrhoids can also be the source of blood loss. Other than that, the parasitic infestation may also result in inflammation and the chronic internal bleeding. So these are the common reasons of blood loss that may result in iron deficiency. Now, other than the blood loss, what else could cause iron deficiency? Of course, you guessed it right, decrease iron intake. Now we know that most of the iron that is required for the formation of new RBCs is obtained from old RBCs. Now why do we need more iron? Now this holds very true in the case when there is increased demand. When could there be an increased demand? The best example would be pregnancy. Here the mother is not only making her own RBCs but is also providing iron for the RBCs of the fetus. So there is increased demand of iron, and it is in this situation, if the dietary iron is not adequate, the mother may suffer iron deficiency anemia. Now the second situation is growing children. These growing children are again making their new RBCs, and their RBCs are increasing in number, and they need more iron to make the new RBCs. Once they become adult, this requirement of iron goes down, and then the most common reason for the iron deficiency anemia comes back to the blood loss. When we are talking about dietary iron, let's talk about what are the dietary sources of iron. Diet iron can be of two types: heme iron and non-heme Now, we have seen in earlier videos that when iron is incorporated in the red blood cells, it is incorporated in heme form. Now, this heme, the source of heme iron is non-vegetarian, and the source of non-heme iron is green leafy vegetables and so on. Now, the main difference between heme iron and non-heme iron is that heme iron is not affected by other dietary components such as calcium, oxalates, etc. But the absorption of non-heme iron is reduced by such dietary components. So it is more difficult to absorb as compared to heme iron. So that was about the dietary causes of iron deficiency. One more reason for iron deficiency could be decreased absorption of iron. So there is adequate iron in the diet, but the iron is not absorbed properly from the GI tract. Now we have seen in the earlier video that iron is absorbed from the jejunum and the duodenum. Now imagine if for some reason there is a resection of this part of the GI tract, there was cancer or some other reasons, if there is a resection of GI tract, there would decrease surface area for the absorption of iron, and that may result in decreased absorption. The second reason could be decreased HCl content, also called as achlorhydria or hypochlorhydria. When there is decrease in HCl content of the GI tract, there is precipitation of ferric and ferrous salts of iron, and this results in decreased absorption of the iron. Finally, if there is decrease in vitamin C, vitamin C is again necessary for absorption of iron. Decrease in vitamin C may affect absorption of iron. So this again can be one of the reasons for decreased absorption of iron. So these are the causes which could result in iron deficiency